Hi, I'm Dr. Nixon, and welcome to the second episode on Healing Peak Regenerative Medicine's Longevity Channel. And today I want to talk to you about inflammation. There are two types of inflammation. There's a good type and a bad type. And the acute inflammatory response, or when you injure yourself and all that inflammation that comes, as if you sprain your ankle or cut yourself while you're chopping something in the kitchen, that brings many healing cells to the area. And that's actually a really good kind of inflammation. It allows our body to build tissues up, heal, create collagen matrices, and essentially reform the area of that joint or that skin area or your digestive system or whatever it is that's been injured. And that's actually what we're initiating when we use PRP or prolotherapy. Acupuncture actually too is just a very minimal form of eliciting this acute healing response that allows your body to bring the attention to that area and all those healing cells. And so that's actually a really good thing that we want to have happen. And that's why prolotherapy, PRP, acupuncture, these needle therapies are so effective. The other type of inflammation that I talk to my patients about a lot, or that I ask my patients about a lot, is chronic inflammation. And really differentiating these types of inflammation, because most people think inflammation is bad. And if we're talking about chronic inflammation, that's very true. And so really learning how to differentiate between acute and chronic is important for the understanding of my patients so that they can create healthy lifestyle habits. Chronic inflammation is when you've had a low-grade inflammatory response happening for a very long time. And that can happen with arthritis is probably the easiest example to talk about, because chronic inflammation breaks down tissue, what we call catabolic essentially, and it degrades collagen, it breaks down the tissues, and then you hear, I've got bone on bone, or, my collagen is not where it should be anymore, and so that's why I have knee pain. And really it's just a festering of really unhealthy cells in that area. And this can also happen in the digestive tract with food sensitivities and food allergies. It's a chronic low-grade inflammatory response that leads to something called leaky gut, which you may have heard of before as well. So hormonal imbalances causing cancer, arthritis, these are all examples. Leaky gut, IBS, Crohn's disease, autoimmune conditions are all forms of chronic inflammation where the immune system really isn't working the way that it should anymore. And so what I'd really love to do, or what I'm really excited to do with you guys, is to teach you about these different types of inflammation and how to make sure that your body is in an anti-inflammatory state most of the time. Obviously, if you exercise, you're going to have an acute inflammatory response. It's actually going to build things up. That's good, right? But if you have a festering long-term chronic issue that breaks things down, that's really what we want to stop from happening. And so your body's going to always move in and out of these states, and really creating a healthy environment for your tissues to build themselves up is what the goal is of this channel, essentially. Aging happens when the body is in a chronic inflammatory place. And so the next few episodes, I just want to lay the groundwork today for this and make it a topic of interest, because really the way that you prevent chronic inflammatory issues from happening is by basic therapeutic guidelines, which is getting great sleep, making sure that you're moving, exercising your body, making sure your hormones are in balance, making sure you're not eating inflammatory foods, making sure you have really good relationships and you don't have toxic relationships that are stressful for you or that need to be eliminated from your life. There's so many different ways to address this. And by addressing each one of these key factors, or foundations of health as we like to call them, you can really prevent aging from happening so quickly, and also prevent chronic disease, heart disease, cholesterol. I know it's kind of amazing that those things relate back to this chronic inflammatory issue. And so I know I'm covering a lot really quickly, but I just wanted to lay the groundwork today for anti-inflammatory therapies, and what inflammation is, what good inflammation is, what bad inflammation is, and what we're really doing when we're injecting PRP or prolotherapy, is that we're really eliciting an acute inflammatory response that lasts about 2 weeks, and we really actually want that to happen. And we don't want to keep that chronic festering inflammation happening that breaks down tissues. So that's all for today. I just wanted to give you guys that first little bit about inflammation. And in the next few weeks, we're going to talk about how to minimize chronic inflammation, which will also minimize aging. So fine lines, wrinkles, loss of hair, and also it will minimize any kind of pain that you may be having. Thank you so much for joining us today, and if you're excited about these topics or you'd like to hear more, please subscribe to my YouTube channel so that you get notified when there's a new video coming. And you can also visit my website at healingpeak.com and join my email list to receive a lot more awesome content on how to prevent aging or slow aging, and a lot more things related to PRP, prolotherapy, and regenerative injection therapies. Thank you so much.